Is a third shot of coronavirus vaccine needed? The UK said it will offer booster jabs to people aged over 50. Other countries are expected to follow suit. But is that enough? This is Inside Story. Hello, welcome to the programme. I'm Kim Vinell. It's feared that the winter season could see coronavirus infections rise, and the British government says it wants to prepare for the worst. It's announced a rollout of a third dose of vaccine from next week. Around 30 million people will be eligible, including everyone aged over 50, people with underlying conditions and health workers. They'll be given at least 6 months after a person has had their second dose. The government says there are signs protection offered by coronavirus vaccines reduces over time. And by using boosters, high levels of immunity among the most vulnerable people can be maintained. Officials say Britain's vaccine drive has reduced hospital admissions and helped avoid lockdowns. Prime Minister Boris Johnson plans to reintroduce measures if needed.
The result of this vaccination campaign is that we have one of the most free societies and one of the most open economies in Europe. And that's why we're now sticking with our strategy. In essence, we're going to keep going. We will continue to offer testing. We'll continue to urge everyone to be sensible, to be responsible, wash your hands, use ventilation, consider wearing a face covering in crowded places with people that you don't know. Stay at home if you feel unwell. Download and use the app, and we will keep further measures in reserve. Plan B.
The US Food and Drug Administration Committee is debating the wider use of booster shots later this week, and a few other wealthy nations have recommended rolling out third doses. But that's not recommended by the World Health Organization. It's asking rich nations to delay the program until every country has vaccinated at least 40% of its people. A group of leading scientists, including experts from the US and WHO, wrote in the Lancet Medical Journal that COVID-19 vaccine booster shots for the general public are not needed at this time. While vaccine effectiveness against mild disease may wane over time, protection against severe disease remains or can remain. Booster shots may eventually be needed for general populations if vaccine-induced immunity wanes even further, or if a new variant emerges that can evade the protection. They cited risks in distributing shots too soon, including potential side effects such as the rare heart inflammation condition myocarditis. Let's bring in our guests. In Cambridge, Chris Smith is consultant virologist and editor of The Naked Scientists. In Doha, Patrick Tang is division chief of microbiology at Sidra Medicine. And in Rabat, Azeddine Ibrahimi is head of biotechnology lab at the Rabat Medical School. A very warm welcome to the program. Thank you for joining us. I'd like to begin with you, Patrick Tang. The advice from not that long ago from the World Health Organization is that we should hold off on booster shots until most of the world is vaccinated. Wealthy countries are steaming ahead with their booster jabs, their plan for boosters. Is it needed?
Well, that's a very complicated question. And I think when you say whether it's needed, we have to answer that at different levels, whether it's needed for the prevention of infection, prevention of severe disease or death, or prevention of disruption to society and the economy. So I think that question is complex, and it has to be answered at all those different levels. So when you say, is it needed, at some levels it may not be for some things, and then for other things it's actually very much needed. So with the evidence, if we're talking only about the healthcare side of this, where the evidence is, it definitely is needed because of waning immunity in certain groups of people. So people that are immunocompromised, that never established good immunity to start with, elderly, and possibly people that reside in nursing homes or long-term care facilities, and possibly as an extension of that, the healthcare workers that care for such people that are in high risk.
Okay, Chris Smith, is there any harm then in getting a booster if you're young and you don't have any underlying health conditions? Because different countries are having different rules around who should be getting the booster. So is there a harm in getting it if it's offered to you?
Well, let's step back and ask the question, what's the purpose of a booster? A booster is intended to reinforce immunity. What's immunity? Well, it means different things to different people in this disease, because in some cases it means not getting severe disease. In other cases, it means not getting infected at all. What we know and have learned over the last about 18 months is the higher your level of antibody, the more defended and better protected you are. And people with really high levels of antibody appear not to get infected at all. People with lower levels of antibody do get infected some of the time, but they don't become severely unwell. So what do we want to achieve? If we want to try to achieve low rates of spread of the infection through a population, we need everyone to have the highest level of antibody that we can muster. If we want to achieve low levels of severe disease, we're willing to tolerate some degree of spread through the population, then that's probably not necessary. And since young people don't develop severe disease very often, they do sometimes, but much less often, then you could argue, well, actually, do they really need a booster at all if they're under the age of, say, 50, which is why various governments in various countries are taking that particular approach. Will the boosters do harm? Well, all medicines have side effects, and vaccines are no exception. So there will be a small number of people who get vaccinated and they get the side effects, which can be trivial, a sore arm, or more severe, a sore head and perhaps brain blood clots if you have a risk factor for some of these vaccines. So it really comes down to who you're giving the boosters to and what your aim is at the end of the day in having a booster program.
Okay, Azeddine Ibrahimi, I'd like to bring you in. What does the science say? What does the research say about how much the efficacy of the vaccines wanes over time and over what time period?
Well, actually, Kim, we are having this discussion simply, and we have to say it clearly, simply because there was a paper in Lancet 2 days ago, and the two leaders, the party leaders of the FDA, talked about that we don't need these shots for the global population. Maybe we'll need it for some specific persons, immunocompromised persons, for example, elderlies or the frontliners, but definitely will not need it for the global actually population. That's something that we have to say. And in comparison to that, the WHO actually for many weeks are saying that we don't need this booster. Just to make it clear why, because we can succeed in locally managing the pandemic and effectively being able actually to eradicate the virus, but we cannot come out of it just by doing that in few places and not doing it around the world. For the efficacy actually and the toxicity, I think it's clear that the efficacy of these vaccines and the third shot will be very helpful. But the other thing, when you are managing the pandemic, I think I will just give an example. For example, if you are in the US and you decide that you will be given a third dose or third shot in New York and not given it in San Francisco, it will be a problem. I think we have to manage the crisis in this way, that we are just one world and we have to give this efficient doses to everybody around the world.
You raise a very interesting point. I'd like to bring that to you, Patrick Tang. Some people who are not being offered boosters are worried about their immunity, particularly people who might have been given a vaccine that was less effective in the first place. Should they be worried? Are those concerns founded?
Well, for different people who are at different risk of severe disease, I think that's where the question has to be aimed at. So for people that are not at risk for severe disease, then they don't have to be as worried as much, right? But people that are in some of the higher risk groups, then they do have to be a bit more careful in terms of what they do, especially if they're having waning immunity, if they've had that only one shot of certain vaccines or two shots of a less effective vaccine, then they definitely have to act accordingly, or wait for their government's plan to roll out third shots if necessary.
You can understand, Patrick, the concern, even just from a messaging point of view and people trying to figure out what is best for them, because for so long, the messaging was get vaccinated, look at what COVID does to you. You could end up very, very unwell. You could die from COVID, get vaccinated. People did that. And now the messaging is coming out in different countries in different ways. Oh, actually, now you may need a booster. So surely you can understand that some people might be concerned about figuring out what they should be doing.
You are absolutely right. It's a very complicated message to get out there. And for many of us at the beginning of the rollout of the vaccine and as the vaccines were developed, probably realized that there might have to be boosters and that, the vaccine schedule that was recommended where 2 shots are given in a 3-week or 4-week period, that wouldn't be enough to give long-term lasting immunity to most people. So I think the initial messaging was to get people engaged and willing to take up the vaccine so that we can take care of the emergency that's right in front of us right now. But with the emergence of the Delta variant and possibly other variants, where the immunity needs to be very strong to prevent transmission of the virus and also to prevent some of the more severe disease, then I think it's important now that we change some of that messaging again. And I think people might be getting tired of this, but the message has changed many times throughout the pandemic as we learn more about the virus and as the virus evolves. So I think, again, we're going to have to do that again. To tell people that a third dose might be necessary for certain people, especially with the evolution of the virus into its current form.
Yeah, we'll come on to the evolution or the mutation of the virus in a second. I want to come back to you, Chris Smith. I believe the UK, and correct me if I'm wrong, is recommending a Pfizer booster for over 50s and those who are at risk, regardless of the vaccine that they got around the first time around. So does that mean the science says you can mix vaccines and it's not going to be a problem?
There's quite a long history of using combinations of different vaccines, and that proves that when you do that, you get a better immune response for doing it. And this is actually called heterologous vaccination. So you use one type of vaccine to prime the pump, as it were, and you use a different vaccine later, or a different combination of vaccines downstream, to stress the system a bit and expand the immune response. It seems to translate into a broader, more robust, more resilient, and therefore more effective immune response. So it's not altogether surprising that we should find that mixing and matching between vaccines can lead to a better immune response. There have been a number of big trials conducted in the UK, including one called the COMCOV trial, which was done at the University of Oxford, and more recently, the COV Boost trial done at the University of Southampton, which we are eagerly awaiting the results from. And they've tested many of the permutations of using different vaccines in different orders and also boosting people with different vaccines off the back of prior treatment with other combinations of vaccines. So they've looked at the different permutations. And what seems to emerge is the best reinforcement, at least in the short term, is to give whatever your first course of vaccination was, a booster with Pfizer's vaccine, which seems to be a good compromise between practicality, cost, efficiency, efficacy, and also the tolerability for the patients. That seems to give the best vaccine outcome across all those measures.
Okay. Azeddine Ibrahimi, a lot of people are talking about how to move from this being a pandemic to being endemic. Can you explain to our audience what that means and what it entails? Does it mean we're going to be getting COVID vaccines every year along with flu jabs?
Well, actually, we have to remind everybody that's why we get to the vaccination, actually. To get to the vaccination to protect people not to be infected. Actually, you can be infected if you are even vaccinated. So the purpose is actually not to develop severe cases for the COVID and actually not to have this pressure on the health system. So actually, every country that will get to a percentage of the vaccination will be actually able to declare that, for example, the the COVID-19 is an endemic kind of disease as not harming the health system. So I think what we'll be doing is not the strategy of zero COVID. I think it's the strategy show that is limited, actually, when we see what's happened in Australia, New Zealand, for example. And I think what's going to happen is just will be kind of surviving the presence of this virus and living with it. And I think it will become endemic. And we see the example in Denmark, for example, where people are saying you can just live your life, and if you get the COVID-19, we have all the possibilities to bring you to the healthcare system that will take care of you. And I think that will be the aim for everybody, instead of looking at having zero tolerance for the COVID-19 and for SARS-CoV-2.
A follow-up question for you, Mr. Ibrahimi. I mean, that's all very well, isn't it, for nations that have high vaccination rates, saying, you know, we'll just deal with it and the health system won't get overwhelmed. But what about for countries where their vaccination rates remain very low? I mean, the continent of Africa, comparatively, the vaccination rates are very, very low. So what does the trajectory look like there?
Well, actually, you are provoking me here, Kim, because when you are talking about Africa, when you see the numbers, it's really a shame. I'm ashamed to see the numbers in Africa of the vaccinated population. We are absolutely at 2% of the population vaccinated. And if you take out Morocco, you are at 1%. And I think what's really why the WHO actually argument for the strategy to come out of the COVID is true, and we have to follow it. Because they are saying we have to get to a certain percentage in Africa. If we leave African countries without any vaccination, what's going to happen actually, just lots of people will be developing new variants. And instead of using these boosters that we are having now, we have to look for variant-based boosters to get rid of the pandemic. So I think the right way to do it actually, and the strategy for Africa is to get enough vaccines and actually not let the virus develop and not let the virus multiply. Because one example that we can give, and we are certainly everybody will agree with it, it's just if we have a lot of immunocompromised people, for example, in South Africa, most likely, like what happened with the C1-2 that is coming as a new variant of interest, most likely we'll have new variants coming from Africa, and we'll come back to square zero and from start all again.
Speaking of starting all again or coming back to the start, I want to talk about Israel. Patrick Tang, most Israelis were vaccinated by March, but then by the end of June, they had the mask mandate reintroduced. People needed to put their masks back on. What does that tell us about what is going to happen for everyone in the future? You know, will vaccination be enough, or will we be wearing masks from here until who knows when?
Well, I think Israel is a little bit of a unique situation. They were lucky enough to get the vaccine very early and vaccinate a significant proportion of their population very early. So, and then with that, they didn't get enough to achieve herd immunity, but they got a significant proportion, about 60% of people vaccinated. But with that, they sort of declared that it was a success, and they dropped a lot of their public health measures, maybe a little bit too early, and not anticipating a new variant such as the Delta variant emerging and getting into their population. So I think that's a unique situation where a lot of different things converged, and in that case, they're very unlucky to have a virus that was able to evade waning immunity in their population because they were vaccinated earlier than most other countries, and then they had also dropped their mask mandate. So with that, they had to take swift action and then had to reverse some of their public health, the things that they had dropped.
Right. So it's this careful balance, isn't it? Chris Smith, a lot of children are heading back to school now, but children, at least in the US, represent more than a quarter of new weekly COVID-19 cases at the moment. Are kids getting sicker with Delta? Do we need to be worried about them getting infected at higher rates?
This has been very controversial in the UK as well, because in the last couple of weeks, we've seen a bit of a back and forth with our politicians and various advisory groups who decide on who should get what vaccines. And what they've been arguing about is, should we be offering vaccines to children? Many other countries around the world, including in the US, but many other European countries, are proactively vaccinating their children. In some European countries, they've got to nearly 100% of their young children aged 12 to 15. In the UK, we're just beginning to embark on that particular journey. And what we see is that you get very large uptake or very large amounts of spread of the virus in that particular sector of society. Why? Because those are the last groups to be offered vaccination, so they're currently susceptible. They're also more likely to be more highly socially networked. They're meeting with each other, they're in school, at university, at work, or public transport, partying, going to nightclubs and so on. And this is all opportunities for transmission to occur. So as a result, there's a higher risk in that particular group that they're going to amplify the infection. So many people are saying, look, we should be actively intervening in this particular sector of society to help to blunt transmission there, because they are an amplifier. They create more cases. Those cases then spread to other people who, while children are at very low risk, and you asked the question about Delta, they are still at very low risk of severe disease with coronavirus of any persuasion. It's about on par with being hit by lightning. Your chance of having a severe run, the risk of post-viral syndromes is a bit higher because of theoretical risk of severe disease in the minority and because of long COVID type symptoms, but because of the societal impact of them spreading the infection. That's why people are saying that vaccinating this group is a good idea, because you can help to protect against all of the above.
Azeddine Ibrahimi, we touched on it earlier, but I want to come back to this. What is the actual likelihood that the virus will mutate and our current vaccines will no longer be effective? Is that a given?
Well, actually, we looked at that in a paper where we looked at the waves of the virus through the year and a half of the pandemic in Morocco. And we watched that there was 4 waves, and they were correlated, all of them, to the presence of a dominant variant. So I think if we look at it now, the speed is like 3 months, and after we'll get a new variant that will be dominating. So I think last time it was like March, April, and now we got one in August in Morocco. So most likely we are looking at by 3 months to have another one. So why we have to prepare ourselves? Simply just for the population to know why. Simply if you leave the virus multiplying by itself, what's going to happen? Every time he will copy his genetic material, it will make errors. And that's what we call mutation. If you combine this mutation in one part that is important for the virus, for example, the spike protein, what's going to happen? You will get a new characteristic and you will get a new variant. And here we'll ask the same question. Is it spreading rapidly? Is it more dangerous or getting more difficult pathologies? And the third thing is this escaping the immunity. And I think we'll most likely get new variant and most likely we'll get this 5th or 6th wave coming our way.
Okay. Patrick Tang, we're nearing the end of the program. I want to ask you quickly, the need for vaccine boosters has in some circles emboldened anti-vaxxers, people who don't want the vaccine, don't believe in it. As of right now, what does the science say, so we can be unequivocal, about how much more likely you are to be hospitalized if you catch COVID if you're unvaccinated versus if you're fully vaccinated?
Well, it's unequivocal that the people that are vaccinated have a much lower chance of being vaccinated, of dying, of being hospitalized, or having even infection compared to the unvaccinated people. So from different estimates, there's at least a 10-fold decrease in your risk of dying from COVID in a developed country, and that risk changes in different places. But there's absolutely the risk of a vaccine is far less than the risk of getting COVID. And I think that has to be the message that has to be brought out. And we have to be careful not to disparage the value of vaccines, even as these variants emerge. That vaccines, no matter how much the variants evolve, so far they have been able to give a good and high degree of protection against severe disease from all the variants so far.
Absolutely. Hey, thank you very much for that. A big thank you to all of our guests, Chris Smith, Patrick Tang and Azeddine Ibrahimi. And thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Vinell, and the whole team here in Doha, bye-bye for now.